Imagine a silent crisis unfolding across the heart of America, where thousands are fighting a battle that many thought was already won. Today, we're uncovering a hidden epidemic in the most unexpected places. This is not just a fight for survival, it's a fight against ignorance and stigma. Hello everyone, welcome back to the channel, where we dive deep into the most pressing health issues of our time. Before we get started, if you're new here, hit that subscribe button and the bell icon so you don't miss out on our weekly deep dives into what matters most. Today we're talking about the top 12 states in the United States with the highest HIV cases. It's more important than ever to stay informed, so let's get right into it. HIV, or human immunodeficiency virus, has been a global health issue since it was first identified in the early 1980s. While global efforts have significantly reduced the spread and improved the lives of many living with the virus, certain regions in the United States continue to see alarmingly high rates of new infections. HIV attacks the body's immune system and, if left untreated, can lead to AIDS, which severely compromises a person's ability to fight infections. Despite advancements in treatment like antiretroviral therapy, which can suppress the virus to undetectable levels and prevent transmission, the battle against HIV is far from over. Factors such as lack of access to healthcare, social stigma, and inadequate education about the virus contribute significantly to its spread. Today, we will explore the 12 states where this crisis is most pronounced, shedding light on the unique challenges and ongoing efforts to combat HIV in these areas. Top 12 states with the highest HIV cases. 1. California. In California, the state with one of the largest populations in the US, the fight against HIV is marked by a diverse range of epidemiological landscapes. Cities like Los Angeles and San Francisco have long been epicenters, historically known for their vibrant LGBTQ+ communities and proactive health policies. However, despite progressive urban health initiatives, rural and underserved areas face starkly different realities. Barriers such as transportation, stigma in conservative locales, and limited health resources exacerbate the spread of HIV. The state continues to push forward with innovative public health campaigns aimed at increasing testing, treatment adherence, and awareness to reduce new infections. 2. Texas. Texas confronts a formidable challenge with HIV, particularly in its sprawling urban centers like Houston and Dallas, where high rates of new infections are prevalent. The state grapples with socioeconomic factors such as high poverty rates and substantial, uninsured populations that hinder consistent access to HIV prevention and care. Furthermore, conservative social attitudes and lack of comprehensive sex education in schools contribute to the ongoing struggle against HIV/AIDS awareness and destigmatization. 3. Florida. Florida's battle with HIV is intensified by its status as a major tourist destination, which complicates public health efforts to track and manage the disease. Cities like Miami and Orlando see fluctuating populations, which can obscure and complicate the continuity of care for individuals living with HIV. Additionally, the state has a high incidence of HIV among the elderly, a demographic often overlooked in HIV prevention efforts. Florida's response includes aggressive testing campaigns and initiatives to link individuals to care promptly upon diagnosis. Soluto. New York. New York has been at the forefront of the HIV/AIDS epidemic since the beginning, particularly in New York City, which was once the epicenter of the outbreak in America. Efforts to combat the virus have been aggressive and to a large extent successful, with significant decreases in new infections due to widespread availability of PrEP, pre-exposure prophylaxis, and robust public health campaigns. However, challenges remain in addressing the needs of marginalized communities, including migrants and low-income residents, who may still face significant barriers to accessing necessary healthcare services. 5. Georgia. Georgia, particularly the Atlanta metropolitan area, faces a severe HIV epidemic, rivaling those seen in the coastal cities of the US. Stigma, poverty, and access to healthcare converge to fuel the crisis here. Georgia has a significant African American population that is disproportionately affected by HIV, often compounded by socioeconomic issues that impede access to diagnosis and treatment. The state has invested in community-based outreach programs aiming to increase education and reduce infection rates among these high-risk populations. 6. Illinois. In Illinois, Chicago stands out as a city significantly impacted by HIV, particularly among young African American and Hispanic men who have sex with men. The city has launched several initiatives, focusing on reducing transmission through community engagement and education, as well as improving access to PrEP. However, rural parts of Illinois face starkly different challenges, such as limited healthcare resources and providers who are knowledgeable about HIV. 7. Pennsylvania. Pennsylvania's HIV rates are concentrated in urban areas such as Philadelphia, where socioeconomic disparities are stark. Challenges include combating the dual epidemics of HIV and opioid use, as intravenous drug use provides a significant pathway for HIV transmission. Local organizations focus on syringe exchange programs and integrating HIV prevention and treatment into substance use disorder treatment programs to address this complex issue. 8. Maryland. Maryland, with Baltimore often at the center of its HIV epidemic, sees a high rate of HIV linked to both sexual transmission and intravenous drug use. The state's response includes a comprehensive approach that integrates free testing services, public education campaigns aimed at reducing stigma, and efforts to increase linkage to care immediately after diagnosis. 9. North Carolina. In North Carolina, the HIV epidemic is heavily impacted by stigma and lack of proper sexual health education. The state has rural expanses where healthcare access is limited, significantly affecting the timely diagnosis and treatment of HIV. Efforts are underway to expand telehealth services and mobile clinics to bridge this gap, with a focus on prevention through education and accessible healthcare services. 10. New Jersey. New Jersey faces a unique HIV challenge with a high density of urban populations in areas like Newark and Jersey City, juxtaposed with substantial immigrant communities. Language barriers, cultural stigma, and fear of legal status exposure complicate public health efforts to reduce HIV rates. The state has been proactive in providing multilingual resources and ensuring that immigration status does not inhibit access to HIV care. 11. Ohio. Ohio's struggle with HIV is exacerbated by the opioid crisis, particularly in cities like Cleveland and Cincinnati, where needle sharing has significantly contributed to the spread of HIV. State and local health departments are intensifying efforts to combat this dual threat through harm reduction strategies, including the expansion of needle exchange programs and increased availability of substance abuse treatment options. Community-based initiatives also focus on educating at-risk populations about the availability of PrEP and the importance of regular testing to catch and treat HIV early. 12. Virginia. Virginia's HIV epidemic reflects a complex interaction of urban and rural dynamics, with significant cases concentrated in the Northern Virginia region, close to Washington, D.C., and in the Hampton Roads area. These regions see diverse populations, including military families and international travelers, which contribute to the complexity of HIV prevention and treatment strategies. Virginia has been working to improve healthcare access and has made strides in implementing comprehensive sex education in schools to address HIV from a preventive standpoint. In each of these states, while the challenges may vary, the common goal remains clear: reduce the number of new HIV infections through better education, more accessible healthcare, and comprehensive community support systems. The fight against HIV/AIDS is not just a medical battle, it's a social one that calls for an end to stigma and discrimination against those living with the virus. By staying informed and proactive, we can all contribute to this ongoing effort and help turn the tide against HIV in the United States. Remember, knowledge is power. Share this video to keep the conversation going, and join us next time as we continue to explore important health topics that affect our communities. Don't forget to subscribe and click the bell for notifications. Together, we can make a difference in the lives of many. Thank you for watching,